Everything about pregnancy, from A to Z. Only on howtogetpregnant.net.
Infertility is a very common problem, particularly in the United States. About 15% of couples will have problems getting pregnant, and by that I mean unprotected intercourse for 1 year without success and positive pregnancy. And so we can attribute about 7% of this to male problems, about 37% to female problems, 35% to problems involving both members of the couple, and in the rest of it, physicians as a group, we just don't know what causes infertility. And so some of the common issues and very common questions that patients ask me is my weight a problem? Well, this is true. Either too heavy or too light. For example, patients who have a body mass index of around 17 or so are more prone to amenorrhea, not having a menstrual cycle. And if you don't have a menstrual cycle, you're not going to ovulate and you're not going to get pregnant. So changing lifestyle, changing eating habits, exercising less, and gaining a little weight is one of the first steps for patients that are underweight. Patients who have an eating disorder, obviously that's a little more difficult to treat and approach. Obviously working with a therapist and trying to alter behaviors is key. But in patients who just cannot get pregnant in the setting of an eating disorder, there are some hormonal therapies such as pulsatile hormonal therapy. Gonadotropin hormone is an option to discuss with an infertility specialist or a gynecologist. On the other end of the spectrum, patients who are obese with body mass indexes of 27 or higher also experience significant problems getting pregnant. Fitting into this category are often people with a condition called polycystic ovarian syndrome. And we know that those patients, if they lose even as much as 5% of their body weight, can restore ovulation successfully. And so that's something to consider. Getting evaluated for infertility, obviously there's male factors and female factors. The male factors are a lot more straightforward, a lot easier to assess for physicians. Semen analysis, looking for motility, doing a sperm count, that's part of the equation for a male. Also a urine test to make sure that the semen and sperm are flowing in the correct direction and not backflowing into the bladder due to some structural or anatomic problem. There are some other hormones that you can measure in men, but the majority of the issues regarding infertility focus on women, and obviously there are a variety of factors such as hormonal factors or anatomic or structural factors. Hormonal factors relate mostly to LH and FSH. Those are two hormones that can be measured, and it's interesting to note that there are some over-the-counter kits that people can use to measure these hormones. The full discussion of that is a little bit beyond the scope of this video, but that's an option for people who are exploring some things to do at home regarding infertility evaluation.